A startling statistic, 100% of us will be affected by it in our lifetime. For most of us, we'll never see it coming or in what form. It does not discriminate against age, gender, race, religion, or financial background. It does not there is no way to prevent it, death. Death affects us all because we all die, and we all know someone who will die. One of the things that I can tell you some of us can do when facing death is be in control of how things will end. It is a patient's right to die. Today I will briefly discuss two items that will fall under the patient's right to die umbrella, which are DNR orders and advance directives. For each of these topics, I will define it, tell you how it affects you and your loved ones, and give you the pros and cons. First, let us discuss DNRs. What is a DNR? According to the American Medical Association website, a Do Not Resuscitate, or DNR, is a legal order written either in the hospital or in a legal form to respect the wishes of a patient not to undergo CPR or advanced cardiac life support if their heart were to stop or they were to stop breathing. The state of New York was the first state to create a DNR law in 1987. So you can see that this is relatively new concept in the field of medical. How does a DNR affect you and your loved ones? Most people that have a DNR order are elderly or terminally ill. There are some of the pros to having a DNR. Patients who have DNR can continue to get medical treatment such as chemotherapy, antibiotics, dialysis, pain medication, and other appropriate treatments. Also, having a DNR prevents a patient from suffering unnecessary pain from CPR, which they are terminally ill or in end stage of life. CPR is a very violent procedure that most people aren't aware of how it is actually performed. In the medical field, there is a saying, if you don't break a rib, you're not doing it right. If there are pros, there are cons. Many U.S. states do not recognize living wills or health care proxies. In the pre-hospital settings, the pre-hospital personnel in these areas may be required to initiate resuscitation measures. This photo, courtesy of DailyMail.com from September 2011, shows 80-year-old Joy Thompson, who decided to take the DNR request one step further than just having a piece of paper. She had the words "Do not resuscitate" tattooed on her chest, and this is a growing trend. DNR are the most basic forms of rights that a patient can enact. How we will discuss a more detailed and more recommended form of patient's right to die, advance directives. First, what is an advance directive? An advance directive such as living will informs doctors about what kind of treatment to administer when a patient is unable to make those decisions personally. In 1984, advance directives became recognized in 22 states and D.C., and in 1994, all states recognized some form of advance directives. What does it mean to you? This means that even if you are unconscious or otherwise incapacitated, your wishes pertaining to your death care can be made known to your loved ones and doctors. The state of Mississippi recognizes their own advance directives. Creating your advance directives in the state of Mississippi is easier than you think. According to the Mississippi State Department of Health website, mdhs.ms.gov, you can download this document titled Patient Self-Determination Act, Mississippi Advanced Healthcare Directives. What are the pros of having an advanced directive? It helps tolerate your family from making difficult decisions on your behalf if they know what you want and doctors know how to proceed with the health care and can help. What are the cons? Advanced directives cannot anticipate every scenario and sometimes be too vague. Most conflicts over them stem from emergencies, when decisions are made rapidly and patients and family members sometimes change their mind about what should be done despite the patient's prior instructions. In Laura Park's article in USA Today, in a crisis, do not resuscitation order do not always work. December 19, 2006, Robert Arnold, a medical enthusiast in the University of Pittsburgh Medical Center who specializes in the end-of-life issues, says merely drafting a medical directive sometimes isn't enough to ensure that the patient's desires regarding treatment will be carried out. He says it is best to also talk to your family and doctor as well, so everyone is aware. In conclusion, death is something that will affect us, and it is important to know what a patient's right to die are, especially in the form of DNRs and advanced directives. I would like to leave you with a quote from Dr. Stephen Metropolis, President of the Mississippi State Medical Association, 2012 to 2013, a physician at Singing River Hospital System. Death does not have to be something that is avoided or denied or ignored, but can once again be something that is sacred, that is part of every life, that is filled with dignity, that honors the person, and is one which we'll call good health, death.